But let's quickly talk about the epidemiology. The epidemiology of typhoid fever. Typhoid fever is endemic in many parts of the world, particularly in South Asia, in Sub-Saharan Africa, Southeast Asia, as well as in Latin America. The World Health Organization, WHO, reports millions of cases, as well as tens of thousands of deaths annually, particularly in regions that have inadequate sanitation, poor waste management systems, as well as unsafe drinking water. The disease primarily affects children and young adults, but all age groups are also susceptible to infection by typhoid fever. Typhoid fever exhibits seasonal variation in endemic regions, often skyrocketing during rainy season due to increased contamination of water sources. International travel also contributes greatly to the global spread of typhoid fever, particularly due to imported cases in non-endemic and high-income countries. The emergence and spread of multi-drug resistance, as well as extensive drug-resistant strains of Salmonella typhi, contributes greatly to difficulty in disease control, leading to high incidence of treatment failure and over-reliance on the limited therapeutic options. So let's talk about risk factors. Certain risk factors predispose an individual to getting infected with Salmonella typhi, leading to typhoid fever. These include poor hygiene practices, consumption of contaminated food or water, unavailability of safe drinking water, living or traveling to endemic regions increases risks. Poor socioeconomic conditions, overcrowding, non-availability or poor availability of adequate sanitation and waste disposal systems and facilities, malnutrition, immunocompromised conditions, as well as conditions that reduce the gastric activity of the stomach, such as use of protein pump inhibitors such as omeprazole, use of antacids contribute greatly to increasing the risks of an individual getting infected with Salmonella typhi, leading to Salmonella typhoid. Let's talk about diagnosis. Accurate diagnosis of typhoid fever is very important in leading to effective treatment and management of the condition. Clinical diagnosis that is solely dependent on signs and symptoms is challenging due to the non-specific nature of the disease, typhoid fever, and its similarity to other febrile illnesses such as malaria and viral infections. And as such, laboratory confirmation is very, very crucial and cannot be overemphasized. Bone marrow culture is the gold standard for diagnosis of typhoid fever. It is the most sensitive method for diagnosis, but due to its highly invasive nature, it is less commonly used. Blood culture is the most practical and the most widely used method for diagnosis, and it is particularly done in the first week of illness when bacteremia is very high and prominent. Stool and urine culture are also very important methods of diagnosis. It is also important to know that serological tests such as the Widal test, the Widal test detects antibodies against the Salmonella typhi antigens, but its major drawback or disadvantage is its limited sensitivity and specificity. Other methods include molecular techniques such as the use of polymerase chain reaction (PCR), which increases sensitivity, accuracy, as well as improved precision. But its major disadvantage is its cost, and as such, it is not readily available in resource constrained settings. Let's talk about prevention. The prevention and control of of typhoid fever is based on good hygiene practices, particularly washing of hands with soap and water. Very important. Availability of safe drinking water is also very important, and also proper cooking and storage of food, especially by food handlers, cannot be overemphasized. Reduction of crowding, of overcrowding, as well as availability of adequate sanitation infrastructure and waste disposal systems and facilities. Also very important is vaccination. Vaccination is very important. It cannot be overemphasized as a preventive strategy for typhoid fever. Commonly used vaccines include the VI capsular polysaccharide vaccine, also the live attenuated TY21A vaccine, live attenuated oral TY21A vaccine. This vaccine is very important. It's usually given 3 to 4 capsules over a week to offer primary protection, and then booster doses are given after every 5 years to reenact antibody protection. There's also the use of TCVs, that's the typhoid conjugated vaccines. These vaccines contribute to offering protection against typhoid fever, especially in endemic regions. Let's talk about treatment. The treatment of typhoid fever is based on antibiotic, antimicrobial therapy, supportive care, and management of complications. Commonly used antibiotics for treatment of Salmonella typhi, which causes typhoid, used to be chloramphenicol, ampicillin, and trimethoprim. Trimethoprim, sulfur, trimethoprim, sulfur, methoxazole. Chloramphenicol, ampicillin, trimethoprim, sulfamethoxazole used to be the commonly used antibiotics to treat typhoid fever. But due to widespread resistance, these antibiotics are now less effective in many regions, and so they're no longer used as the antibiotics of choice in treating typhoid fever. Currently, the antibiotics now used include fluoroquinolones, fluoroquinolones, azithromycin, azithromycin, and third generation cephalosporin such as ceftriaxone. Currently, fluoroquinolones, azithromycin, and third generation cephalosporin such as ceftriaxone are now the antibiotic of choice used in the treatment of typhoid fever. But the antibiotic used out of the fluoroquinolones, azithromycin, and ceftriaxone depends on local resistance and susceptibility patterns.